Joining me in the Health Hub is Assistant Medical Director for University Hospital's Emergency Department, Dr. Robert Hughes. What are the symptoms you want people to watch for, and are you assuming everyone who comes into the emergency department is infectious?
I think we're getting to the point where that's going to become a reality. Right now, we understand a little bit better the constellation of symptoms that come with coronavirus. Although, as data starts coming out of different areas of the world, we're starting to roll that into the way that we identify this disease. It was thought earlier on that somebody who was having diarrhea, per se, wasn't necessarily at high risk, but that seems to be a more pervasive symptom. So, as we learn more information about the disease, we are starting to identify more and more the people that are going to present with it. It presents very much like any sort of viral illness, including the flu, which comes with a non-productive cough, shortness of breath, but it tends to lack some of the other symptoms like nasal congestion. We're seeing a lot of similarities with the dry cough and the shortness of breath, particularly as the disease starts to get a little bit more intense. And then we're finding out that some other symptoms like lack of taste and lack of scent are also things that we ought to be looking out for. So the more data we can gather on what this presents with, the better we're going to be able to identify and address it. That people of certain age, over 60, people with medical comorbidities, particularly high blood pressure, diabetes, cancer, they're a special population that should look out for potential advancement of symptoms. This disease, from what we know, tends to have a slow build, and around day 7 or 8 of symptoms can become a little bit worse. And so people should start paying attention to the amount of time that they've had their symptoms. And if they have increasing shortness of breath, they can't catch their breath, they have dry cough, these are worrisome symptoms and reasons to contact their doctor.
Committed to bringing you facts, not fear. Monica Robbins, 3 News.